When Hurricane Helene slammed into North Carolina last month, it shut down a major supplier of the country's IV fluids. The resulting shortage is affecting hospitals in Arizona and around the country. Joining us now is Dr. Frank LaVecchia with Valleywise Health. He's also with the ASU College of Health Solutions. Good to see you again. Thanks for joining us.
Thank you.
First of all, what is IV fluid?
Well, it sounds pretty simple. It's just water and salt and some electrolytes. And it sounds like something you could just make in your house, but it's so much more complicated than that. It has to travel across the country from North Carolina to here, and quite frankly, around the earth. So very difficult to make and stay on the shelf and remain pure.
So it is very difficult to make, which means this one supplier does make a big difference. But I would think just for security purposes, you'd have other suppliers around.
Yeah, this place in North Carolina was 60% of the U.S. IV fluids.
Wow.
So it was like the perfect storm people talk about.
And so one supplier can make that big of a difference. How much of a difference is it making?
Well, right now, the hospitals in general usually have about 4 weeks supply backup of IV fluids. You don't have too much, but you want to make sure you have enough. And right now they're under 10 on average, under 10 days supply. But the good news is we're hoping by Thanksgiving this is going to be replenished.
What are you seeing at Valleywise?
At Valleywise we're seeing, everything's computerized now. So if I write an order for IV fluids, if you come into the emergency department, it used to just run for a couple of hours. Now after one bag is done, they say, are you sure you want a second bag? If I write you for IV fluids, they say, you sure this patient can't take it by mouth? If I write for medications IV, they ask you to go orally.
I know that Banner is postponing some surgeries and others are delaying elective surgeries. Have you guys hit that level yet?
No, we haven't. And almost all elective surgeries get IV fluids. In general, in the emergency department, about 10% of people will get IV fluids. And that's one of the reasons to stop it if it's elective. We haven't stopped elective surgeries. And I can also say that no patient care has been compromised.
PD solutions are also affected. What are PD solutions?
PD, like pediatric solutions?
Yes.
And things that you drink that are sterile. Like we think about Pedialyte, for example.
Yes.
And you know, in other countries, they make it themselves. So that is one of the things that we look at and we recommend that parents do make it.
Are there alternatives or stopgaps to IV, to PDs? I mean, it seems like it just seems like we're dependent on one place an awful lot.
Yeah, it is crazy, and it has to be so sterile. Remember, this thing has got no bacteria in it, no viruses, and then it's got to sit on a shelf for 6 months, go through different temperatures, different extremes, and then still be able to put in your vein. If it's something you drink, sometimes it's a little bit safer than what goes in your vein.
As far as IVs and maybe dialysis and other things from different countries, are we in the market?
Yes, we are. That's one of the ways of dealing with the shortage.
Yeah.
We are getting fluids from England, Canada, and actually China.
Really?
Yes, that's right.
Is there an inspection process? I mean, you got to inspect it a little bit, don't you?
It looks the same to me, except there's some different writing on it sometimes.
I see. And you mentioned conservation measures at your place. Is that pretty much happening nationwide at hospitals?
Yeah, the hospital for Medicare basically did a study and looked at the first 2 weeks in October and saw just in emergency departments, the use went from 5% of all patients to 2%.
Interesting.
So, yeah, cut down more than half.
So it does make a difference. And is the Biden administration, I heard, perhaps invoking some sort of wartime protocols here? What's that all about?
The wartime protocol sees we can break a little bit of rules, and everything has an expiration date in medicine, and expiration dates are probably overblown. If it's going to expire in a year, we might put on it that it's going to expire in 6 months just to be safe in general. So they've extended the expiration.
Okay, and I would imagine there is also a lot of work and a lot of effort in rebuilding this facility in North Carolina.
Right, absolutely. And the hope is, though, they're going to replenish us or start to replenish us by Thanksgiving.
Is there hope that along with getting this place in North Carolina fixed up, we start building more facilities?
That would make sense, and you and I are in the market right now for one.
Yeah, I'm sorry to keep harping on this, but I can't understand how something this important can be localized to one spot. I mean,
it's insane. It goes from there to Hawaii, for example.
Yes.
It doesn't make sense.
So you think things are getting a little bit better?
Yes, absolutely. And there's hope on the horizon. I think they're going to have fluids before they thought they were going to have fluids.
A last question here. We're talking about IV fluid here, but are there other aspects of healthcare that are so dependent on single facilities that an act of God and nature could shut the whole thing down?
I think you mentioned dialysis, and dialysis, you know, we filter your blood, kind of an artificial kidney, a big machine, and a lot of water gets used on that. A lot of water, gallons and gallons kind of go out. And it's, unfortunate, but there's no choice. Yeah, it's required to keep the patient alive.
Yeah, we did something with microchips when we thought we weren't doing all that well with America. Maybe we need to start looking at stuff like this.
Absolutely. This is the basics of medicine.
Yeah, Dr. Frank LaVecchio, again, Valleywise Health. Good information and good to have you here.